comparing health insurers and rates.
Okay, so there have been 10 filings by 9 insurance companies for increases in the 2024 health plans. And this is through Access Health Connecticut, or you've heard of the Affordable Care Act. So that's what they're looking for increases in. And the insurers are looking for, you have to note this, a 12.4% increase in individual plans and a 14.8% increase in small group plans. So this is just simply unaffordable for our residents here. Wages haven't increased by anywhere near that amount, probably not even half that amount. So on top of everything else we're experiencing with inflation, to pay this much of an increase for health is just too big a burden. All right, now on the bright side, the insurance department doesn't automatically grant the full amounts requested by the companies. And they know that increases put strains on our families. And in my opinion, we should be working to reduce costs. Now, there'll be a final ruling on this in early September.
I have to say, Representative Foncello, that how could, this is one case where I think the state can clearly make an assumption that 99.999% of the people don't want this to happen. And at this kind of alarming rate, it is beyond wrong. And don't get me wrong. I'm not against capitalism or companies making money. I'm not against that. But when you do so at the not just the expense, but the expense and health of individuals, taxpayers in our state, I think it's deplorable.
It is. And, of course, the carriers are going to make their argument that the increases are due to things like, inflationary costs, rising costs of drugs, healthcare, demand for services, that sort of thing. So they say in order to provide those services, it costs more. I just don't think the percentage increases they're asking for are what we need to be paying for this. We have to cut back somewhere.
Marty, you're a former MI guy, military intelligence officer. I think you got to find a way to sneak some people in there and find out what the heck is in the heads of these health insurers.
I'd like to do that. I don't know if I can or not, but you make some good points there.
We're talking with Martin Foncello, who's our state rep in the 107th.